Here's some patriots out to support Randy Hultgren
Go Randy.
and against Obamacare. Thank you, ladies, for showing up.
In the rain. Kill Obamacare.
Kill Obamacare.
Yes.
Thank you. And there's the resistance. Actually, we're the resistance.
Yeah, we're the counter.
Those are the Prog-tards who support it. Hey, you guys that support Obamacare, anybody want to go on camera? Want to go on camera regarding Obamacare? I'm doing a documentary, those who support it. Anybody want to debate Obamacare? No one? Anyone?
Thank you for your interest. We're not interested.
Not interested? Okay. I guess a lack of facts prevents them from debating. Hello, officer. This is Mr. Hultgren's office. And we had some stalwart patriots out here today.
Yeah, and it's a little cold.
And it is cold.
A little
Yeah.
cold is really.
You know,
Rain doesn't keep us away. No.
1 year ago yesterday, we stood out in front of Melissa Bean's office in the driving snow to support, obviously, repealing Obamacare. Of course, she voted for it. I'll take you ladies off camera now. But now we have a new rep in the 8th District, and that's Congressman Joe Walsh, who's a stalwart patriot voting against Obamacare.
Unconstitutional, although I do believe that providing universal health care is a moral obligation.
Okay.
And I believe if we had a public option, people and businesses alike could opt out if they so chose to.
But they so chose to. So
Yes,
you're
it would-
pretty much against Obamacare because it forces businesses to actually buy health insurance.
Yes, but I
From
do
private
believe it's a
carriers.
moral obligation.
It's a moral obligation.
Yes.
Okay, so that means to provide health insurance, you mean subsidizing by the federal taxpayer? Is that what
No.
you're saying? How would you then pay for this moral obligation?
You cut down on the military and prison budgets to a certain extent, use that revenue to create new private industry, and that new private industry can use the revenue that they make in the economic market to provide their own type of health care insurance, and we can build from there.
Would you say the VA would then would have to be cut? Because that's, you know, basically federally funded health care for our veterans.
Well, if you cut down the military and prison budgets, I don't think it would be necessary to cut down on the VA.
Do you know how many people are waiting for their claims to be paid in the VA right now?
No.
There's 1 million veterans right now. The reason for that is that we don't have the money for it. Do you have any idea what our debt is right now, our country?
The debt, I believe, is about $14 trillion.
That's correct. And how much do you think the Democrats added since January 2007 when they took over both chambers of Congress?
I would say, I don't have that hard number, but I would say it's at least half a trillion.
It's about $8 trillion.
$8 trillion.
Yes.
Yeah.
It's more than,
Now,
more
the
than
CBO,
half 14.
the CBO just
If that is true, why did the national debt stand at $13 trillion right before Bush left office?
It was actually closer to 5.6 trillion. If you do that, if you go back and look, you'll see it's 5.6 trillion. That's the debt.
right.
That's the debt the Democrats took over in January 2007. Since then, they've added all this debt to our nation, close to 8 trillion.
I
The
don't believe those numbers.
Well, you can look them up. You can Google them. You know, am I right, ladies?
You're correct. And
Okay.
in fact, during the last 4 years, the middle 4 years of Bush, in other words, the deficit went up because of the war, the 9/11 attacks, the first 2 years of the Bush administration. And then for the next 4 years after that, the deficit went down 4 years in a row while Republicans controlled Congress. And then beginning in 2007, the debt began to skyrocket.
Correct.
There is plenty of evidence to the contrary, though, that I have seen. And I am not looking at any Democratic affiliated data. I'm looking at scientific data provided by the U.S. government and by
That's what I'm talking
State.
about too, yes.
Yeah, that's our actual debt. So the CBO just came out with a reassessment of Obama's budget that wasn't passed last year because he irresponsibly didn't pass a budget for God knows how many years. We've never had a budget before, but he tried to pass a budget. CBO said it was $2.5 trillion off. So if Obama's budget actually goes through, we're much more than $14 trillion in debt. What do you think about that? Do you think that the money for providing people health insurance just comes out of thin air, or who do you
No,
think
I don't
pays
believe it comes out of thin air. No, I believe that it should come out of the military and prison budgets because there is so much money being wasted and so much money being invested in just creating bombs and weaponry. I don't believe that we need all of those bombs and weaponry and resources for the military and prison.
What percentage of
Yes.
our debt you think is military based?
I do not have the numbers.
Okay, it's a small percentage. It's less than 30%. So if that's the case,
If it's
really,
less than 30%, that's still a significant percentage.
it is, right? But really, most of our income, most of our debt and taxes go toward entitlements, like Medicare, Medicaid, right? You know, when Obamacare finally is fully into fruition in 2014, we're going to add 16 million more people onto our Medicaid rolls. Do you know what the Medicaid situation is like here in Illinois?
No, I do not.
doctors currently are waiting almost 2 years to be paid by our Medicaid systems. So they're being forced to provide care for people who are not paying, many of them who can qualify to buy their own health insurance, and instead they're basically taking it in the throat. They're not getting paid. So now we're looking at 2 years of our doctors not being paid. They're not taking our All Kids Covered program anymore, which was supposed to be set up under S-CHIP to provide for children who are legitimately not able to pay, or children of parents who are legitimately not able to pay. Unfortunately now, because so many people have been added on to our Medicaid program under former Governor Blagojevich, who expanded all kids, right? All kids or kids care, to family care, to moms and babies, who provides maternity coverage for people who are 8 months pregnant, and they don't have to qualify other than income-wise, and it provided thousands and thousands of dollars to people who are illegal. What do you think about providing health care to people who are illegal in Illinois?
I believe that is against the law. I can see that. I believe that moving a few U.S. military bases to the border would actually help.
Okay.
And replacing, the border patrol with U.S. military bases.
If you had to guess, if you just had to guess, you may not know this number, how many illegals do you think are on our current All Kids program right now? Our Kid Care program for Medicaid?
I don't have those numbers.
75%. So we have 3/4 of those on our All Kids program, which was passed under S-CHIP, who are illegal aliens. Do you think if that's being allowed right now, that we'd also be covering more illegals under Obamacare once it's fully implemented? Do you think there's anything in the legislation that would stop that from happening?
Well, let's see where this idea originated from. According to the sources that I consulted, again, they're nonpartisan, this health care bill actually originated out of the mind of a former Republican Senator, Robert Dole of Kansas. And so, originally, the proposal by the president had been about universal health care coverage, which we did not get.
Correct.
We did not even get close to that.
Correct.
And instead, the Bob Dole measure got submitted into both legislatures. And when the president tried to enforce a public option, the center and the right destroyed it. I mean, and I'm not just talking about Republicans. I know there are a lot of conservative Democrats who also voted to kill the public option.
Are you for single payer?
It became a mandate.
Are you for single payer health care?
Yes.
What do you think it's like in Canada? It's single payer now. How do you think the Canadian healthcare system is?
I think it's actually good, because what you have there is that, yes, your tax dollars might be covering someone else's expenses, but their tax dollars are covering your expenses as well. Yeah. So it's a wash.
Do you think there's any waiting time for healthcare in Canada?
No.
No.
Relatively none. I mean.
Did you know last week there was a baby who was condemned to die by the healthcare death panels in Canada?
Healthcare death panels? I'll tell you about the healthcare death panels. The healthcare death panels in this country are the insurance companies who are trying to decide who gets care and who does not get care. Okay.
So it's pre-existing conditions you're talking about?
Yes.
Do you know who's responsible for
like
pre-existing conditions?
Yes, the insurance companies themselves.
No.
Yes, it is.
You ever read 1996 HIPAA law passed by Congress?
No.
In HIPAA law, they passed a law that allows people who are on group health insurance, which is 90% of the American insured, to be able to move from one group policy to the other group policy with no pre-existing conditions. That's why when you move from one job to another job, no one ever asks you what medications you're on or if you're overweight. That's just automatic guaranteed issue, right? HIPAA law, HIPAA portability law. When they wrote that law, they excluded HIPAA portability law for people who buy individual health insurance policies. So that's 14 million self-employed people. So the reason we have pre-existing conditions at all is because of the federal government. It is their fault that we have them. So let me ask you a question. Do you think it would be better for the insurance companies, instead of just covering people for pre-existing conditions anytime they want coverage with no proof of prior coverage, let them drop the coverage as they're doing in Massachusetts now, come back in 6 months and buy it again when they need more treatment, which is fiscally unsustainable? Wouldn't it be better to just extend existing HIPAA portability law to people with individual plans? Then we wouldn't have pre-existing conditions. What do you think about that?
Well, would you explain that one more time, because you're speaking a little bit
Was it too fast? Okay. In 1996, the federal government wrote a law called HIPAA.
Yes.
Okay, and most people know HIPAA as privacy laws, right? But there's a very important clause in HIPAA that extends pre-existing condition coverage or portability from one policy to the other with no regard to pre-existing conditions. So if you leave a job and you've had 18 months of prior coverage, the law, HIPAA law, written in 96, says that if you had 18 months of prior coverage, you've had no lapse of more than 63 days, you're guaranteed coverage for pre-existing conditions, even if you're 8 months pregnant. Not that you could be 8 months pregnant. If you're 8 months pregnant, you have coverage for any of your pre-existing conditions. When they passed that law, they left out any protection for pre-existing to individual policyholders. That's why when you try to buy an individual
Which have
plan,
nothing to do with the government. Individual policyholders have nothing to do with the government because that's part of private industry. Government does not have the authority to regulate private industry.
but they've been doing it.
They've
They've been doing it since 1996. That's why group health insurance carriers have to take you, no matter how sick you are, when you go to a new policy. So the new Obamacare law, just like Romney Care, which is now called Mass Care, if you are sick, you can wait until you need coverage, until you need treatment. You can buy a policy, guaranteed issue. As soon as you get your MRI or your cancer treatment, you can dump the policy, which they're doing right now in Massachusetts. Wait till your next MRI is due or your next outpatient therapy is due. Buy another policy on a guaranteed issue basis. Got to pay for the care, then they dump it again. If you do that, it's the same thing as if you wrecked your car, right, on 290, and then you called State Farm and said, I need a policy to cover my car. It's the same concept. Insurance is about managing risk. And that's why we have insurance companies that have actuarial tables that can set prices for health insurance based on what their risk is. When you eliminate any actuarial tables and you guaranteed issue every policy when everybody needs it, that's going to bankrupt the insurance company. So indeed, Obamacare may indeed provide a single-payer healthcare system. What do you think about that?
Well, the thing is, look.
You didn't know about baby Joseph last week?
No, I did not.
Baby Joseph needed a tracheotomy. He didn't get that tracheotomy to help him breathe because the rationing panels in Canada said it was too expensive. So they put him on a ventilator, which caused his condition to become exponentially worse. They condemned him to death in Canada, and a Catholic priest, just last week, went to Canada with his organization and rescued that child. You know what happened to that child today? That child is being treated in an American hospital and just got a tracheotomy and is able to get quality care in healthcare. What about the Canadian premier who snuck across the border to Florida to have his heart surgery and Fox News cameras caught him? The premier in Canada. He's the one who's pushing for socialized medicine, and yet he sneaks over to Florida to have his healthcare done.
Okay, first of all,
do you know any of these stories?
No, but what is...
But my point is that instead of having the surgery he needed because the cost was too high, they put him on a ventilator, which caused his condition to exponentially become far worse. And they literally condemned him to die because the cost to keep that boy alive in his condition would be more expensive than what the Canadian healthcare system was willing to pay for. And that's not one isolated example. It happens all the time. And again, I bring back to the premier who was caught in Florida. You know what he said when the cameras caught him in the Florida airport? He said, it's my body, my heart, and my choice. And that's why he came to Florida to have his healthcare system, have his heart surgery done. Because you have to wait in Canada to have certain conditions done. You need an MRI, it takes you months to qualify. There's a man named Rick Baker in Canada who makes a very good living arranging healthcare for Canadian citizens to skip across the border and get things done they need done. There was a gentleman who had a brain tumor. He had to wait 3 months just to get an MRI to diagnose his brain tumor, and then even longer to have it removed. So Rick Baker set up an appointment for him to come over to Ohio, and he had it done immediately, and it saved his life. And that's just one example. So whenever we put government in control of our healthcare system, it ends up leaving us with massive deficits. What condition do you think Medicare is in right now?
I would say Medicare is on the rocks a little bit, and that's basically due to the downed economy.
And how much do you think Obamacare is going to take from Medicare? Because we've already been told by Speaker Pelosi, when she was Speaker Pelosi, that Obamacare will take $500 billion from Medicare over the first 10 years. Now, they say that's supposed to, according to Kathleen Sebelius, extend the life of Medicare, but also provide new massive entitlements for 30 million people to be able to get new health insurance. So in other words, she's saying the same $500 billion does the same thing twice. In other words, you can't double count. But if you really look into what Richard Foster said, you know who Richard Foster is?
No.
He's the chief Medicare actuary. He came out with a new study only 2 or 3 months ago that says Obamacare, when you count in how much is taken from Medicare Part A and how much it robs from Medicare Part B, over the next 20 years, it's going to take $4.95 trillion out of our Medicare program. Not million, not billion, trillion, to provide these massive new entitlements. So if that's the case, how do we care for our senior citizens? Would there not be rationing of care if we're going to take close to $5 trillion out of our Medicare program, which you stated yourself is already on the edge? How can we support Obamacare if it does that?
Well, first of all, I'm not sure where you're getting your numbers from, and I'm taking them, every one of them, with a grain of salt. I would need to test these out on the internet. I need to look these up, and I need to see if you are actually correct.
You can go to truthaboutobamacare.com, and I have all the links there. Okay, all from reputable sources. Richard Foster is, again, the former chief Medicare actuary, who's come out against Obamacare because it takes that much money from Medicare. We also have a nation of people who, for the first time in American history, are moving toward the senior citizen age. We're going to have to provide those people. They're going to have to rely on Medicare. And we can't possibly do that if we're going to rob $5 trillion from Medicare when it's already, as you stated, on its edge, or in my position, bankrupt. So if that's the case, how can we do that? Also funding Medicaid. 16 million of the new 30 million insured are going to be on our Medicaid rolls. What do you think of Medicaid?
Well, I think Medicaid needs to stay there, because if you get rid of Medicare, you get rid of Medicaid, you get rid of Social Security and pensions and unions, all the bunch. I mean, you're not going to have a middle class in this country anymore, because unions, whether you like it or not, in the private sector are responsible for the wages that you earn, regardless whether you are a union member or not.
You're for private sector unions?
Yes, private sector unions.
What do you think about public sector unions?
I think they should be abolished.
God bless your heart. So he's good on that. He's good on the unconstitutionality of the healthcare mandate, right? Thinking. So you're close. You just need some more facts. See, I've been interviewing people who support Obamacare for a long time, and I find out that they're just adverse to facts. It's not that they're bad people. They want the right thing. Their heart's in the right choice. They just don't know what situation our Medicaid system is in.
That's very interesting, because the other side says the same stuff about you.
Exactly. So we really have a dichotomy here. We have two segments of society. In my opinion, it's the 47% who don't pay taxes against the 53% who do pay taxes.
Well,
and that's where we are.
I got to test that number again.
So you could find that at truthaboutobamacare.com.
I don't trust any cable network news. I don't watch Fox, CNN, MSNBC, or BBC. I don't watch any of that.
We do internet. Mostly internet.
Internet's really where the truth is.
internet as well.
Yeah, media pretty much is dead in this country.
If you want to know how big a billion is, let me give you some numbers of how big a billion is. A billion
USD?
A billion
US
seconds ago, the White Sox were playing in the World Series. Not talking about playing in 2005. I'm talking about 1959 World Series against the Los Angeles Dodgers. That was 1 billion seconds ago. That's how big a number a billion is.
That's actually
a billion minutes ago, Jesus was preaching.
Right, that's
and
beautiful.
Jesus was walking on the face of the earth a billion seconds ago. A billion minutes ago. That's how long a billion minutes
And how many
is.
billion is in a trillion?
And there's 1,000 billions in a trillion.
And how many trillion are we in debt?
14 trillion.
So try to stack up those numbers. See, our primary concern,
Interesting analogies.
as conservatives, our primary concern is the massive expansion of Medicaid. The University of Government Control of Healthcare. Here's why. The American Academy of Cardiology in 2005, they did a lengthy study on comparing those who have surgery on Medicaid compared to those who have surgery on private health insurance. And they found out that the likeness to die after surgery on Medicaid is 50% higher than those who have private health insurance, because the reimbursement ratios for Medicaid are so poor. So government said, well, we can't let that stand. We got to put more big government in there and fix that. So they commissioned the University of Virginia to do a follow-up study in 2009. And in 2009, 97% more likely.
Please, international rights and
Here's Randy Hultgren. Thank you. You're close. You're very close.
All right, I just have one last comment.
Go ahead.
First of all, I understand the waste in Medicare and Medicaid. The thing is, why not empower private insurances and public insurances alike?
Yeah, I
Make
agree.
them compete in the economy.
I agree. You are so close. You're so close.
Who's keeping
Really?
them from competing right now? The government is.
Government is. Do you understand? In 1979, we had.
I disagree.
Listen,
I don't
we
think
had
government is
252 mandates.
An impediment to private insurance.
We had 252 mandates placed on health insurers in 1979. Do you know how many we have this year, including Obamacare's mandates?
No.
Almost 2,000 mandates. So when you mandate, like in the state of Colorado, the liberal legislation in Colorado just this month said that every carrier must cover maternity coverage immediately, starting today, January 1st, 2011. Do you know what happened? All the carriers left, leaving less competition. It's the same thing in California. They have primarily about 6 carriers that they can choose from to provide health insurance. You know how many health insurance companies are in America?
Very few.
1,300.
Why are there only 6 in there?
Why are there only 6 in California? Because of these massive mandates. The insurance carriers say it's no longer profitable for us to offer health insurance. So we're just going to pull out of this state and do business where that kind of tyranny is not imposed on us, and we can actually turn a profit.
Sure, I'm against tyranny of the few, but here's my question. Why not utilize at least state government to enforce economic competition? So that way there are no There are no select few companies monopolizing an entire market.
That's correct, and that's what's happening right now. You understand, mandates are the reason that's happening. State mandates are what's forcing health insurers to either pull out of the state. Now, in this case, we have a federal mandate that encompasses all states now. So now they've basically gone against the
Well,
Constitution.
the companies ultimately make the choice whether or not to leave.
Are you Randy?
I am.
Steve Tucker.
Good to see you,
Great to
Steve.
meet you.
Randy,
I'm doing a documentary.
Randy Hultgren, good to see
This
you.
gentleman's for Obamacare, but he's very close to being against it. He's just fact adverse, which I think is the case most of the
Yeah,
time.
but he's
Well,
really
look,
rational and reasonable.
But he's rational and reasonable and intelligent.
Discussion is good.
And this guy is incredible.
I would not call it Obamacare because it is actually an idea that comes from former Republican Senator Robert Dole of Kansas, not the president.
Thank you all.
Randy, thank you. Keep fighting for us.
Well, I would actually call
Keep
it,
fighting for us.
I would call it Dole Care, if anything.
Okay, well, you know, the current health care reform legislation is very similar to what AHIP proposed when Clinton was in office. Very similar. There's a website you can go to called Fire Dog Lake, which is also linked on my website. And it's mostly a liberal, progressive site. And they've broken down the bill and realized that a lot of it was proposed by America's health insurance plans. Because America's health insurance plans, as a whole, many of them thought, well, gosh, if I support this, then I get 33 million new customers that have to buy my product. Imagine if you made a better widget today in your garage, right? And you just didn't have a marketing budget. You didn't have Andy Griffin pushing for it, using federal tax dollars to do advertisements. All of a sudden the government passed that they had to have your widget. You think you'd sell more widgets? If it became the law you had to buy your widget? Of course you would. That's why AHIP, United Healthcare, had a truck out in front of the Capitol building with free checkups supporting Obamacare. Why did they do that? Because they saw all of these customers coming and they had to be forced by law, right? Then shortly before the bill was passed, they pulled out the mandate which allows the IRS to collect fines, right? Of course, we were told it wasn't a tax, but now we know it's a fine. But anyway, the insurance companies thought we're getting all these customers, right? Well, now, according to the current healthcare reform law that passed, the PPACA, now the Internal Revenue Service doesn't have the authority to actually collect fines. They can collect fines, but they can't seize your assets. So, for instance, if you don't pay your taxes, they will levy your home. They will levy your wages or guarantee your wages. Isn't that called guarantee wages? Garnish your wages. Thank you. I made up a new word. I'm Sarah Palin.
Actually, garnish has been around for a long time.
Okay.
I've heard it since
I said guarantee. That was wrong.
Oh, guarantee.
Yeah,
Okay.
guarantee. You know, like
You meant garnish.
yeah. Okay, so
It's probably freezing.
yeah, I am told. Yeah. Where was I? What did I say? What point was I on?
About
Oh, okay. So the IRS, so what they did is they pulled that out because conservatives like us were saying, hey, you can't force us to buy health insurance and then levy the IRS against us and then levy our assets if we don't. So they removed that part from the healthcare legislation. So now the insurance company said, well, wait a minute. If you can't force criminal penalties for not buying health insurance, then how are you going to collect the fine? You can't. And if we have 47% of the American taxpayers not paying taxes, and 53% actually pay taxes, right? Then how are we going to force people to buy health insurance? We know they're hiring 16,500 new IRS agents, right? We know they just hired 5,000 new IRS agents last month to the cost of $11 million just to collect the 10% fine on tanning salons. That's in the legislation. So if that's the case and we can't really collect the fine, who's really going to pay to insure 33 million new people? The people who are already paying taxes. Do you understand why conservatives, most of us who pay taxes on a regular basis, are against this legislation? We want what you want. We do not want to be forced by a tyrannical government that doesn't recognize our Constitution to force us to buy health insurance they design, not that we design. I'm a male. I don't have the right plumbing to have a child. But if I buy health insurance in Colorado, I got to pay for maternity coverage. I lead a healthy lifestyle. I'm not into substance abuse. If I buy insurance in California, I have to pay for people who are substance abuse addicts, not only for their treatment, to help them clean out. I got to pay for that. Those kind of mandates drive up the cost of health insurance for everybody. Starting September 23rd of 2010, we added 87 new mandates onto every health insurance plan in the country, which is why I brought some of these. I'm an evil health insurance broker. Wasn't evil until last year, then I became evil. These are my clients' Blue Cross rate increases. Okay, I got to cover up the names so nobody can see it on camera. Here, this is a 44.78% rate increase on health insurance for the first time that he's ever got a rate increase. Why? Why did he get that rate increase? Because we added 87 new mandates onto it. There's 4 more, but I can't flip it without seeing. Here's another one, 30.17%. These clients had no claims last year because Blue Cross and every other carrier in the country is forced to add 87 new preventative care mandates for quote-unquote free, which means no copay, no deductible. Well, it isn't free because somebody is paying the health insurance premiums. That's my clients who are being forced to be paying massive extra premiums to cover these quote-unquote free new preventative care benefits. And that's just the preventative care mandates. Wait until 2014. And you know this wonderful thing about kids? You know, they get covered for pre-existing conditions with no regard to pre-ex. That sounds great to the uninformed. To somebody who sells health insurance, let me tell you what's happening with my clients. Before Obamacare was passed, and that became official 9/23 of 2010, and every child in the country had to be covered without regard to pre-ex, the state of Illinois passed a similar law right here that said that every health insurance carrier that sells individual plans has to offer coverage to children with pre-existing conditions, which sounded great. So people all over Illinois were calling me, hey, my kid's really sick. I heard I can put her on my plan. Yes, you can. But the state of Illinois didn't set a cap as to how much the insurance carriers could charge you more for that sick child. So they decided to put a cap on. You know what the cap was? 5,000% more. So the client didn't believe me. So I put the plan through, put the application through to put her child on who has diabetes. You know what the premium was just for a child? $5,264 a month. So you know what I did with that child? I put her on an existing high-risk health insurance pool, which we've had in this state for years. We've had them in 35 states for years, long before Obamacare passed, to help people with pre-existing conditions that can't get coverage in the individual market. It's called the Illinois Comprehensive Health Insurance Plan, ICHIP. That's where I put that child. You know what the premium was on ICHIP? $214 a month. And that child has coverage for all of her pre-existing conditions.
And so you're saying that the cap is actually 5,000% more than
what they can charge.
more than 214.
More than a base premium for that child. So the premium ended up after underwriting to be $5,264 a month. Now, Obamacare passes, and now it says that every carrier in every state must provide coverage for children with pre-existing conditions with no regard to how sick they are. So let me tell you what's happening now under Obamacare. Now it's better. Now it's only 500% more that they're charging for sick children. So all of these lies from our president that states that your children can get coverage for pre-existing conditions without regard. There is nothing in the healthcare law that stops insurance companies from charging more money. Now, imagine when any adult, no matter what age, no matter how sick, come 2014, can buy a health insurance plan. Imagine how much more they're going to charge then. Do you understand? So this is why I support your ideology, which is to stop more government, get government mandates out of the way, allow the private sector to compete, because it's the only way to bring down health insurance costs. Why can I not buy a plan that's sold in Colorado when I live in Illinois? Who prevents us from selling health insurance across state lines? Do you have any idea?
Well,
it's not the insurance industry.
Well, think about it. Think about it. No, under Illinois constitutional law, you are not allowed to vote outside of your precinct, right?
Mm-hmm.
So why would they let you buy insurance from another state?
I have no idea what those two things have to do with each other. Here,
Under Illinois law, you can vote outside your precinct. I voted when I was 8,000 miles away in Vietnam.
Actually,
if you're an absentee ballot, though.
That's an absentee ballot, but yeah, I voted outside of my precinct.
buy
with an
anything
absentee
outside
ballot.
of
Point though, and to reverse that, not you phrased it that a person in Illinois should be able to go to buy across state lines and buy a policy in Colorado. Why can't the company in Colorado sell a policy
That's correct.
to anybody they want in Illinois and any other state for that
Yeah.
matter? Why can't they? Because the government doesn't allow them. The state
That's
insurance
correct.
commissioners restrict
Right.
what companies can sell policies
right.
in each state.
where do you think
It's
Apple's
totally
profit
rigged.
margin would be today if Apple could only sell iPods in Illinois? Do you
Say
think
that
they would
again.
have?
Sorry,
where
I'm
would
just,
where would
thinking,
Apple's
listening
profit
at the same
margin
time.
be if they can only sell iPods in Illinois? Do you think they would have more profits or less profits?
They would obviously have less profits. But
That's
the
correct.
thing is, I don't understand why you want to buy insurance from the state of Colorado when you live in Illinois, and at the same time, you make a big mess about the Premier of Canada getting a medical care in Florida.
Because selling health insurance across state lines creates more choices. Canada,
And so,
through their tyrannical health
across
care,
international lines,
no, across state lines. I'm talking about the United States.
yes.
Selling health insurance across state lines increases competition. You have more products to choose from. The reason that California has 6 options to choose from is because the California liberal legislation piles on all of these mandates, which makes it more expensive for consumers to buy health insurance. You should not have to pay for drug rehab coverage. You should not have to pay for maternity. You should not have to pay for infertility, because you could never get pregnant. And if you wanted infertility, you should have the choice to add on a rider to your plan, and you pay more, not everybody. But the Obamacare legislation thinks that it's fair in their big liberal hearts that everybody should pay the same premium. That's called